Alright, good morning guys. How are you doing? Long time no see. I'm Chai. Welcome to Heart with Doctors presented by Sunway Medical Centre, Sunway City. So, what is the topic today? We are going to share about the insights on geriatrics. You might have a question. What is geriatrics and what does a geriatrician do? And how can we prevent something bad from happening by having a geriatric screening? I'm sure all these questions, I have all these questions, you will have all these questions as well. So please make sure you stay with us until the end of the show. All these questions will be answered. And also guys, for your information, Malaysia will be an aged nation by year 2035. How to define an aged nation? When its population, 15% of its population is senior citizen, that means that the country will become an aged nation. So, and there's a doctor called Veronica Luca, actually is a medicine specialist. She mentioned that Malaysia is ill-prepared. In other words, we are not prepared for Malaysia to be an aged nation. So guys, let that not become you and me. Let us prepare for it to become an aged nation. How to prepare for it? Later on, we have two doctors on this geriatrics field. We'll answer all the questions and share more about the insights of the geriatrics. But for now, let's see who we have online. So I think I should mention some of them here. Good morning, Aileen, and good morning, Aisling. Yo Ite, good morning. And Bahadur, good morning as well. Thank you so much for joining us this morning. And Tanya, congratulations. There's good news for you guys because throughout the show, especially at the end of the show, actually we have prepared 5 prizes to give away, which is portable electric juicer. We will ask 5 simple questions. If you got the answer right, you stand a chance to win one of those. And all the answers for all these questions will be in our show. We will mention the answer in our show. So please make sure you pay attention. Of course, at the beginning of the show, we also have mentioned that as long as you share this live streaming, you will stand a chance to win Grab vouchers as well, Grab e-vouchers as well. So please make sure you share it out because you're not only doing yourself a favor, you probably are doing a favor for your friends who are 55 years old and more because today we really want to focus all the elderly, all the senior citizens. We want to help them, especially if you have an elderly aged parents at home. You definitely need to stay with us until the end of the show. If you are 55 years old above, definitely what to do. You must stay with us until the end of the show. If you are 55 years old or below, then please do yourself, please do your friends a favor. Please share this FB live streaming to help them because this is very important. We must prepare for Malaysia to become an aging nation. Not only that, also prepare ourselves to be aging because everybody will get old. That is inevitable. So let's prepare that. So who are the doctors with us today? So we have, ladies and gentlemen, please welcome Dr. Jolene, Consultant General Physician. Alright, and also we have Dr. Chen.
Good morning, everyone.
Alright guys, can you please give some flowers, some comments, and say hi to Dr. Jolene and Dr. Chen in the comments, please? Okay. Alright, thank you so much. I see that some of you actually leave a comment there. So, welcome to the show. Alright, and then, by the way, we do not plan this. As you can see, both of the doctors are actually wearing pink. I'm wearing blue. It's so typical stereotyping, right? Male is blue, girls is pink. But we do not prepare for it. We did not discuss it, but it's just like, the way it is. So I think it looks good because it's quite a fresh look on us, right? So I think, and also guys, once again, please make sure you pay attention on our show because we're going to have 5 portable electric juices to give away. If you share this live streaming, you're going to stand a chance to win the Grab e-voucher. There will be 10 winners be picked and also be announced in this show. All right, let's see. So Dr. Jolene, Dr. Chen, I think the first question, what is geriatrics? To be honest with you, right? I only recently know about this word because my mom fell down last month, and then my mom is 86 years old. Then Dr. Chua, who is the pediatrics, orthopedics, actually he came and said, "Oh, your mom is 86 years old. You should see a geriatricians." So the first when I heard this word, right, I thought something related to geography. You know what I mean? Because like, archaeology, geography. So what is geriatrics?
Yeah. So basically, I'll take this if you don't mind, Jolene. Geriatrics is the care of the older people.
Right.
So geriatrician is a doctor that specializes in the care of older people. I'll give you an example. Like in the UK, there's a lot of geriatricians. They can specialize in a lot of fields. For example, like Taito, you gave an example that your mom got admitted to hospital, and orthopedic surgeons say like you should see a geriatrician. Usually we see people older than 65 years and above. So the orthopedic surgeon, they will actually look at the surgical part, but we as a geriatrician come in and have an overall look at your mum and provide the care that be able to suit the needs of the older people. A lot of geriatricians, they can look after older people with memory problem, people with falls, people with incontinence, people with Parkinson's disease, or people that need undergoing surgery. That geriatrician can actually optimize their care before the operation and after the operation. And now they are more towards people having cancers. They are geriatrician enriching, working together with the oncologist to provide the care as well.
I understand. So, what Dr. Chen is trying to say is that, geriatrician actually specialize in all the elderly, all the older senior citizens, especially 65 years old and above. But, I'm glad you brought that up because in UK, even I heard in Singapore, it's quite common already, right? But Malaysia, we always generalize in everything. For example, right, when we talk about ice cream, doesn't matter, it's cone, doesn't mean it's a lollipop, we say ice cream. and it's time, especially related to healthcare. We must make sure we know all the different specialties that we have, especially what we can provide in Sunway Medical Centre, Sunway City. Okay, there's something also Dr. Chen has mentioned about the falls. I think it makes perfect sense why we need a geriatrician to take care of the fall, especially when an elderly have fallen down, because we always very scared. Like my mom, I'm always very scared because my mom is 86 years old. Every time when she falls, I'm very worried. And it makes perfect sense because they're aging, they're aged. So what is my question to you or to Dr. Jolene, what is the most common causes of the falls for the elderly?
I think there can be many factors for an elderly to fall down. And commonly, we sometimes we do not know what is the exact reason for the fall. So sometimes it can be because of a medical condition. So it can be because there's a silent heart attack, or it can be a silent stroke. So whenever there's a fall, it's important to get investigated. It's important to seek medical attention to know whether there's an underlying medical reason for it. So when you come to the hospital after a fall, you get evaluated, you get different tests done to make sure that there's no underlying medical reason for the fall. And then, of course, if there's no underlying medical reason, then the other important reason is whether there is a mobility issue. There's an unsteady gait, maybe the muscles and the bones or the joints are not so steady as we age. So because of that, they are at higher risk of falling down. Which is why then a geriatrician is very important in this area, because we want to try and help our older persons to strengthen their joints, strengthen their bones, so that they're able to prevent all these complications from happening and prevent falls from happening as well.
I understand. So that is something new I learned throughout what you have just shared, right? Because usually when we think about when an elderly falls down, it's because of the floor is slippery. But you mentioned something very interesting, because of medication.
Yep.
Why would that be a cause?
So, I mean, a lot of times in an older person, they take a lot of different medications.
True, especially those hyperplasia, high glucose,
diabetic medications. Yes. So when there are so many different medications, we don't know whether there may be interactions between the medications, or whether the sugar may be too tightly controlled, the sugar is now too low, or whether the blood pressure is too tightly controlled, the blood pressure is too low. And when blood pressures are too low, sometimes you can feel giddy, and that can precipitate a fall. You can feel giddy, and then you feel unsteady, and you're at higher risk of falling down as well. So it's very important to review medications in an older person, because a lot of times we start taking medication and then we carry on taking the same medication indefinitely, and then you don't get it reviewed. So you don't know whether is the dosage still correct, is it is it too much now, is the dosage too high. So it's important to get yourself reviewed and checked, so that you get your blood pressure under control, it's not too low, and then get your sugars under control, so that sugar's also not too low and neither is it too high.
Right. I think you brought a very important key point there, right? Because sometimes when you started to have all these medications at a younger age, not very young, so maybe 60 something, you start taking all this kind of medication. But as time goes on, we will learn that we try to be smart and pandai. We will go to the pharmacies to get for the same medication because it's exactly the same. But however, as you get aging, and you probably shouldn't having the same dosage for the medication all you have. But the thing is that we have never visit the same doctor again, we just get the supplies, from the pharmacist. That is very good point. And now I would like to ask Dr. Chen, why, I think we all know, but I would like to hear from a professional, why is a big concern for the elderly to fall?
Yeah, because fall can lead to injury. So people worry if you fall and you have injury. If it's minor injury, people say, never mind, it's an aging, so you fall. But actually it's not. Some people, we see a lot of people fall and have broken bones. So when you have broken bones, it leads to go to hospital. Then older people may fear of falling. Then they don't want to walk anymore. You say that, I don't want to walk anymore, I'm scared of falling. They lose the confidence. Then it increases their risk of falling because they don't move anymore. Their muscles get weaker, or sometimes they get strong, the muscles get strong, the joints become not flexible, then it's like a vicious circle. Then you just don't get moved and then you fall again. So the other part of things that fall, we also have to look at, to add on, sometimes is a lot of reasons that can fall. Is it your eyes problem, your balance problem, your feet problem? And you mentioned earlier that early on it might be the environment. Is it slippery floor?
Yes.
Or is it a different environment? Or is it too dark that you can't see very well? So we have to pinpoint whatever it is to try and prevent fall so that the older people don't suffer from the complications of falls.
Yes, exactly. I think, actually, I would like to use my mom's example. My mom actually fell down 3 times. Well, many times, but the 3 major ones. And then the first 2 actually has caused her to do a surgery on both left hip and right hip. And then, by the way, the surgeon is Dr. Chen. And after that, the latest fall actually, we have no idea why she fell down because the floor was dry. And she was having the walking stick, and then after that, her eyesight, she was wearing glasses. So I suspect it's because of the imbalance, suspect of the muscle weakness. So all this, right? We need to educate ourselves, especially if you have someone at home who is an aged parent. You definitely need to understand all this because it's not just about the environment. It's not just because the floor is leaking, it's slippery. Because most of the people would think that because they fall down in the toilet, that is the main cause. The elderly fall down is because of the slippery floor. So I think it is very important for us to know all about this. And then something I would like to share as well, because Dr. Chen actually mentioned something very good. It is a good point. For an elderly, when they got hurt, when they get injury, and then it will a lot of complication. Because what I noticed, since the first major fall from my mom, before that she was very active. She do a lot of house chore. I'm sure your parents do that as well. But as soon as she has limited mobility, actually I noticed her mental health deteriorating, and then after that she wasn't very sharp anymore. She has poor memory, physicality, from a physical point of view, she also very slow. So I think the mobility actually is not just not able to move, actually impact the holistic of the physical and mental health. So I think, and then one thing that I also realized, the longer the higher age, the older she is, the recovery period is long, and then that can lead to bad return. So what is bad about bad return? Because I think a lot of people do not understand that, because especially it can lead to a longer recovery, maybe some bad sores. So can explain what is a bad sore?
I think a lot of times when after a fall, for example, it can lead to a very negative vicious cycle. I think we need to understand that after a fall, we tend to want to try and protect our elderly by
don't move,
stay at home, don't do any more housework, don't get yourself at risk of anything. We try to protect them by restricting the things that they do, and sometimes actually by doing that we're actually causing more harm, because by doing that, they are actually more restricted. We restrict their movements, we restrict the things that they can do. And actually it can be mentally also not so good for them, because it's also depressing, because they end up becoming sad that they cannot be involved with the things that they like to do and the things they enjoy doing. So for example, a person who likes to cook and stand and cook, and then now you say, oh no, don't stand so long anymore in the kitchen, because if you stand so long in the kitchen, you might lose your balance and fall. So you end up restricting a lot of the things that they can do. So that becomes a negative impact physically as well as mentally as well. And of course, you were saying earlier on about what are the other negative impacts of a fall. Yeah, so after a fall, if you become restricted, you become more chair-bound, bed-bound. You always sit in the chair, always lie down on the bed to rest because you don't want to move around. Then you're at higher risk of getting bed sores, which is actually a broken skin in the pressure areas. So usually, commonly, it's at the buttock area.
Yeah. And then there's the part of the body is very difficult to be recovered, because she was because the patient is bedridden. Like for example, my mom actually, she got a bed sore. Previously, I didn't know what is a bed sore, because when we talk about bed sore, we thought it's painful, aching, but actually bed sore is more than just painful and aching. It's about a wound. So I think we need to be very careful, and especially I do agree with Dr. Jolene that although we want to limit their mobility, but need to have a balance. We need to be wise about what they can do, what they cannot do. At this moment, we would like to take a few questions, because there's some viewers, our audience have questions for Dr. Jolene and Dr. Chen. So let's see. The first question is from Anna. Just wondering if you have a pre-existing health condition as 65 years old, is it better to see a specialist for that condition or a geriatrician, or both?
So it depends on what your pre-existing condition is. So sometimes a lot of older people, they come with non-specific presentation. They don't, let's say younger people, let's say if I have a heart attack, I have this chest pain, I get very sweaty, then it's straight away, very likelihood is heart attack. Then obviously you go to see a cardiologist for that. For older people, sometimes, like Dr. Jolene mentioned earlier, even if they have a fall, it may be a heart attack. They present very not typical like the usual young people. They may present as a fall. They may present as, I just nearly slipped. Or they became a bit more confused, mong cha cha like that. Or they may present as, usually I can go to pass urine, okay, now I cannot control my urine. So this is part of what we call the geriatric syndrome. So if you're not sure who to see, you can go and see a geriatrician. Then they can find out what are the specific issues, and then either they can treat it or they can refer you on to the specialist that can help you with it.
I hope that answers your question. Anna, if you have any further questions, yes, please type out your question in comments. Our admin will sure pick up the question and we can further ask Dr. Chen. And then the next question is Katie. Well, that's good for her father. She said, my father loves running and he's still doing marathon even at 65. All right. Is it safe for him to do so? Do you want to take this question?
Yeah, sure. Okay, I think it's wonderful to hear that at 65 you're still running a marathon and keeping yourself very active. I think that is one thing that we want to send a message across, that if you are physically active, you should continue to keep yourself physically active, because you want to prevent health complications and issues as you age, because inevitably there will be changes in our body that happens as part of aging, and these are things we cannot control. Our vessels get a bit more stiff as we get older, and these are some things that we cannot control because it's just part of the aging process. But one thing we can do is keep ourselves active, and I think if he's able to continue running, he doesn't have any chest pain, he doesn't have any breathlessness when he runs his marathon, I think it's good that he continues doing that.
Right. I think there is another thing I would like to add on, right? Because as you mentioned, it's some precondition, provided he doesn't have any chest pain, and also provided his bone density is good. So I think, in other words, please make sure you do a proper screening to make sure that you're actually in a great shape to do all this. Cannot consider vigorous activity, but do all this active activity to make sure you are safe. Even though, but for some reason, there's an accident happen when you fall down, it won't hurt your bone. I think that's very important to make sure you do a screening. Especially now, we actually have the geriatric screening package, and then we will show you what are the QR code later. That is a perfect screening package for all the elderly, especially 55 years old and above, right? So, and this another question here is in Mandarin. I will try to translate in English. All right, for Xiaoma, I might know him. All right, 我爸爸有三高，身体也经常疼痛，他每天需要吃很多药，这样会不会对身体不好？You can understand?
Yes.
Okay. Oh, for our audience. Okay. His father has high glucose, high blood pressure, and high cholesterol, and then also have aching here and there, and have to consume a lot of medications. And will this cause problem to his health?
Yeah. So basically, I advise to see a geriatrician to review, because geriatrician is expert in medication review. So they'll look at your condition and look at your medication, and then have a discussion with the patient, and then see what medication is important for your dad. And does the patient suffer from any side effects from it or not? Then we will prioritize what is important for your dad, and then have the medication for it, and recommend what should stay on it as well, because everything is balancing between the benefits of the medication and the side effects of the medication.
I understand.
And then especially, let's say people on a lot of medication, just now Dr. Jolene mentioned falls, when they're on a lot of medication, especially on blood pressure medication, when they stand up, they may feel a bit woozy, imbalanced, and probably it's the blood pressure that dropped when they stand up. It's what we call a postural hypotension.
What is that?
That means when the blood pressure, when they stand up from sitting, the blood pressure drops suddenly, and they become imbalanced or feel dizzy, and then predisposes the patient to fall. So we have to have a look what causes it. A lot of medication predisposes that. Okay. So even though sometimes, patient, they have medication to protect their heart, then we have to balance it up. What is important? Is it the heart or is it the falls risk? So everything have to come to a discussion, and then come to a plan that suits the patient needs.
I understand. So in other words, right, one of the benefits of seeing a geriatrician actually give the holistic view. It's not just about the medication. It's not just about the muscle strength. It's not just about the condition.
Yes.
It's actually holistic. Kind of like when you try to do a renovation of a house, you not just renovate your living room.
Yes.
You actually need to look at how many family members you have and all that. So it's pretty much similar.
Yes.
I hope you all understand what I'm trying to say. All right. So another question here from Dennis. He is 70 years old, and he has a balance problem. How can he handle this? How can he overcome this? Maybe Dr. Jolene.
Okay, I think balance issue, it can be many different reasons.
Right.
Yeah, so sometimes it's because of the legs or the joints that is causing the imbalance. Sometimes it can be because of ear imbalance as well.
Oh, true.
Yeah, so if you have hearing issues, or if you have ear imbalances, that can also affect your balance as well. Or even in the nervous system, in the brain, sometimes that can also cause issues with your balance as well. So I think if you have not got yourself evaluated or checked, perhaps it's a good idea to get checked and see a geriatrician to get yourself reviewed to see what is the actual underlying reason. And often, in order to know what to do next is to know what is the underlying cause. So if we find out what's the underlying cause, we treat the underlying cause, then we can advise on what's the next best step to do to prevent or to treat the underlying giddiness.
I understand. All right, one more question from the audience, from Ara. Hi doctors, does certain medicine for high blood pressure will cause a long-term effect? Does certain medicine for high blood pressure will cause long-term effect?
Okay. all medications have side effects.
All medication. It depends on whether it's severe or mild. Correct.
Yeah, and then whether patients suffer from it. So it just depends on the individual patient whether they need to stay on that medication. Then we will recommend it. If the patient suffer from the side effects of it, then we will consider stopping it or change to a different medication. But a lot of people doesn't suffer from a lot of side effects, then we will say continue with it. So it just depends on the situation, on the condition of the patient.
I understand. All right. This another question is from Luisa. What is mild cognitive impairment? Is it dementia? I think we'll save this question later because we'll touch about the dementia area later towards the end of the show. So please stay with us until the end of the show, and we definitely will answer your question on that because we would like to elaborate more about dementia, not just about to answer your question only. So, and also guys, if you have not shared this Facebook Live, please make sure you share because we have Grab e-voucher to give away. You still have a chance, we have not selected any winners yet. But soon, in about 5 to 10 minutes, we will select the winners and we'll announce in this show itself. So please make sure you share this Facebook Live. So actually, you're not doing yourself a favor to win the Grab e-voucher. You're also doing your friends a favor, especially those who are 55 years old and above. You also do your parents a favor by knowing more about the geriatrics. All right. The next question that I would like to ask Dr. Jolene and Dr. Chen. Earlier, we have been all the topics are surrounding the falls. So I think our audience would like to know how to prevent from a fall.
Okay, sure. So I think one important thing about preventing falls is we must make sure that physically we are always kept active. So a lot of times we need to remember to strengthen our joints, our muscles, because actually to prevent falls, it's more complicated than we think because to maintain stability and maintain a person's steadiness is actually a combination of different organ systems. So your joints and your muscles, your bones, of course, they must be in quite good shape. And actually, the nervous system, the brain controls a lot of different parts of our body and our actions as well. So our brain health is also important in order to maintain that function. And of course, vision. So if you cannot see very well, then of course that is also going to increase the risk of falls. Vision or hearing. So it's important to keep all this in check. Keeping yourself physically active, exercise, that helps improve your joints. And of course, we know that to keep our brain health in a good shape, we need to make sure that blood pressure is kept under control, sugar is kept under control, and we keep ourselves mentally and physically active as well. And all these things together, they will help to prevent falls. And I think earlier on we also mentioned about the environment factors.
Right.
So a lot of times at home we also need to make sure that the environment at home is safe. So there's no clutter, the walkway and the pathway is clear, the toilet's not slippery, it's not wet. Sometimes we do recommend installing grab bars in the toilet so that you can hold onto something when you're showering, or even a shower seat. Where you can sit down when you shower.
I will do the floor as well.
Yes, the anti-slip floor. So that's also very important because when you soap yourself and you use the shampoo, then it's just going to make the floor really slippery.
And also in the past, my mom had fallen from the bed. So actually, I bought those hospital tub and have the barricade. Also, right? And that's the thing that I would like to discuss with both of you as well, right? When there's an unfortunate event happen, if the fall happened, what does the witness of the family should do? Because, for example, my case, for the first 2 times when my mom fell down, and after I see her condition, I feel she's comfortable, I was the one who brought her to the medical center. But for the 3rd time, the reason why, actually I didn't dare. I didn't dare to brought her to the medical center by myself because I feel she has difficulty in breathing and all that. So I do not know why I didn't dare. It's truly based on my gut feeling. I do not know what are the deciding factors when I should carry her by myself or actually I should get assistance by calling an ambulance. So maybe can Dr. Jolene or Dr. Chen share some tips or deciding factors what the witness should do when there's an unfortunate event where the aged parents fall down?
Yeah, so I think if you see your aged parents fall down, I think first thing first, stay calm. Don't panic.
Right.
Don't panic. Okay,
Understand.
sometimes if you panic, the patient also will get panic.
True.
Yeah, so you assess the surrounding, whether there's any danger or not. Make sure that, because sometimes I scared people fall, then they'll have all the floor with the water and all those things. Make sure that it's all safe, environment safe. Then you approach. Then you have a look. Ask the patient, how are you? Is the patient responding to you? If they are not responding, you have to call for help immediately.
Right.
If they are responding, you ask, is there any pain or anything like that? Then say if there's any pain, then you ask, where is your pain? You make sure that they're breathing, they're speaking to you. If they're speaking to you, they're breathing, so it's safe. If they're not speaking to you, then you call for help immediately. Don't wait. Call ambulance straight away. So once they're speaking to you, ask, is there any pain? Have you hurt yourself? If they're able to answer you, then you know it's quite safe. You can take some time. So, and then you notice that, let's say if a patient, they're able to stand up themselves, they feel they're steady, make sure they slowly crawl to a place that has a furniture that's quite sturdy, then get up to the furniture. But if they stay on the floor and they cannot move their leg, then you suspect any broken bones. So don't move the patient and call for help.
I understand.
Immediately.
Dr. Jolene, do you have anything else to add?
I think if you are uncertain, you're not very sure, I think definitely call an ambulance, because sometimes we do not know whether there are some injuries internally that you're not very certain about. But you know, if your elderly is able to respond to you, is able to tell you whether there's pain or not, then you can assess the situation first. Situations like if you have breathing difficulties, if the person says there's chest pain, there's very severe pain in the joints, or even head injuries. So definitely if they are vomiting, they have head injuries, do call an ambulance and send them to the hospital for further evaluation.
I understand. Okay, thank you so much for sharing. I think now is a good news for the audience. You know, we're gonna announce the winners who shared our Facebook Live, and our admin will tag your name in the comment section. So please make sure you watch out the comment whether your name is tagged or not. Alright, 10 winners who will get the Grab e-vouchers are Lim Siu Chan, Nurita Bahran, Grace Fu, Chong Chen, Bishan Lee, Wee Tat Wei, Enatan, Yoite, L.S. Lee, and Jane Yu. Congratulations. Our admin will tag your name in the comment. Please make sure you check out your name in the comment. And also, you know, guys, if you have any question, please, it's a very rare opportunity. We have both geriatricians to be on our show and answer all of our questions. So let's take some questions. Actually, there's quite a lot of questions, but we unfortunately this show is only 1 hour, so we have to selectively select a question that we would like to answer. Okay, the next question is, okay, wait, alright, will geriatrician proactively reach out to other consultant specialists in medication adjustment is anticipated upon review?
Yes. So let's say, because geriatrician actually works along collaboratively with other people. Let's say the patient is under other specialists for this medication. If the geriatrician think they need adjustment of the medication, they refer back to the specialist and have a discussion whether is there any medication changes that is more suitable for the patient, and have a discussion and see what is the best for the patient.
I understand. Alright, the next question is, to keep brain healthy, what kind of nutrition is appropriate to slow down the inevitable degenerative aging process?
Okay, I think this is something that I think is in a lot of people's mind, you know, about supplements or what to eat and what to take as an extra. Actually, the important thing about keeping our mind and our brain healthy is actually keeping it active. So if we keep our mind stimulated and keeping our mind healthy and active, actually you don't really need to take anything extra from, you know, extra supplements. So a lot of times things that we suggest to do is If you are somebody who like to play chess, play mahjong, these things that stimulate your brain and they make you think and analyze, those are good activities to do. Reading is good. Learning a new skill. So some people who are retired, if you're very free, go and pick up a new musical instrument or join a club to sing, do exercises. These are very important in terms of keeping yourself active. There are many supplements out there now. So many different things that people sell and people talk about. But supplements is something that, as its name implies, is a supplement. So if you can take your food and your nutrition, get your minerals and your vitamins from the food itself, that would be best.
Right.
So, keep yourself healthy with adequate vegetables, fruits, and that's where you can get your vitamins from. If you really want to think about taking supplements, I think that the advice and the suggestion is do speak to your doctor first before you start taking anything, because not everything is suitable for everybody. It really depends on your underlying health condition, what other medications that you're taking, because there may be interactions. So don't take supplements by yourself and buy it without reviewing it with your doctor first.
Again, there is a holistic view of your health condition. And I would like to add in also, because my mom is illiterate. She doesn't know how to read because, she's 86 years old, and then back then there's really not much chance to go to school and to get education. So what I did was, since she is illiterate, she doesn't know how to read, she doesn't know how to use smartphone, but she loves sewing. So I let her to sew all my clothes, even though I know that I won't wear. You know what I mean? So I can even post out some of the clothes that my mom sewed. It's really here and there, and then it's a whole shirt is like all paste with small clothes. So this is what I did for my mom, so to keep her brain active.
Yes.
All right.
I think it doesn't matter how it looks like in the end of the day, as long as she enjoys doing it. And there's something for her to do. I think that's the important thing.
Right, exactly. So this is why it is. So if you all have any aged parents at home and you'd like to share some of the tips, please share in the comments as well. So let's take another question. My mom is from Wu. My mom is approaching 60 years old and has been forgetting things from time to time lately. Is this a symptom of Alzheimer?
So I think it's better to get assessed first, because symptoms of Alzheimer's, repetitive is one of it, but sometimes you have to say impaired judgment, whether it has actually affect the activities of daily living, which means has affect like finances, cannot count, cannot do the finances, or is it they can't able to wash themselves, dress themselves. Before we can say that this is Alzheimer's, being repetitive and some memory problem may be a sign, but may not be Alzheimer's. It's better to get assessed first before we decide.
I understand. So next question from Lim. How can we tell whether it is a fall that caused by stroke? Oh, okay. Her question pretty much like this. How can we tell whether the fall is caused by stroke, or is the stroke that caused the fall?
Okay.
All right. She had in fact stroke after the call. I'm not sure. I'm not sure it's a typo or.
Infarct.
Stroke.
Yeah.
Okay. After the call.
Okay. So sometimes it's a little bit of a chicken and egg thing. So we do not really quite know whether is it the fall that led to a stroke or a stroke that led to a fall. But often when a person comes into hospital with a fall, then we definitely need to do a brain scan to evaluate. And if there is a stroke, then often that is the precipitating cause for the fall, because what happens in our brain is, nervous system is a very complicated structure. The brain is a complicated structure. So it controls all our movements, control a lot of our different actions. So if that is going to affect the mobility, then that person is going to feel unsteady and fall. So often if there's fall and you scan the brain and there is a stroke, and in this case you're mentioning about the infarct and the stroke in the brain scan, then that indicates that may be the precipitating reason for that fall.
All right. There is a question on the next question is about why is it important of screening for healthy aging? So actually, this is a perfect question that leads to our screening, because as I mentioned earlier, actually we are having a geriatric screening package, and this is specifically designed for the aged people, older adults, 55 years old and
yes.
or above. So can you Dr. Jolene, can you explain a little bit about this screening package? What's the difference between this package than the normal health screening?
Okay, so actually in this geriatric health screening package, the focus is as we've put the age above the age of 55 because we want to try to screen early for complications as a person gets older. So the key few different things that is different from the other screening packages is that we do specifically screen for the mental health. Depression is something that not everyone wants to freely talk about, and sometimes in our elderly, in our older persons, they may not want to open up to their own children if they feel lonely or if they feel sad or they feel worried about their own health. They may not want to open up to their own children, but when we do a health screening like this, we may be able to pick it up because they may be more open to speaking to a healthcare professional. Aside from that, we also do the memory screening, which is the cognitive part.
Right.
So we screen to ask a few questions, and there are some assessments that we do in the screening as well to check whether there is memory issues. And if there is memory issues, then following from the assessment, we will then refer to the geriatricians to do a more thorough evaluation of the memory. Aside from that, there's also the muscle screening, which is for checking the muscle weakness, whether there's a person is at risk of muscle weakness and muscle loss. And because we know muscle weakness and muscle loss is something that will predispose a person to falls and physical disabilities. Yeah. So aside from that, of course, in the package, there's also the other regular screenings like the chest X-ray, ultrasound. But specific to it also is the nutritional screening. So we also make sure that they are taking nutritionally adequate, and also we check the bone density as well, because osteoporosis is something that is common as we get older, and we are all at risk of it. So if we screen for osteoporosis, then if there is evidence of osteoporosis, then we'll be able to advise what to do subsequently.
I understand. And then actually Dr. Jolene had mentioned a few key points that I would like to highlight as because this package is designed for the older adults, especially 55 years old or above. Why is 55 years old? Like for example, right, I'm 47. Can I go for this screening? Because the earlier the better. Right? But right now, we always think that the earlier it's detected, the better. Why I'm not eligible for it?
Oh, well, actually, there's no real cutoff where we say, at 47 you cannot come for this test.
Okay.
But I mean, the recommendation is that, above the age of 55, because that's when I think a lot more of the physical changes as we get older starts to surface a little bit more.
Right.
And that's when perhaps the tests that are specific to the package is a bit more relevant. But if you are 50 and you still think you want to get checked, feel free. Yeah, I think
but it's definitely, if you are 55 years old or above, you definitely need to do this geriatric screening. And you mentioned a few things in the package that is really catch my attention. For example, right, the muscle weakness. And what is the possible outcome when you do the assessment? And then what's the next step? Do they go straight away to see a specialist or go straight away to see a geriatrician?
So if there is muscle weakness detected, so the first steps usually is, there's education. So we'll educate in terms of the steps on how to strengthen the muscles, what are the exercises that you can do, because there are different exercises that are a bit more resistance involved, that we can advise based on the person's capability, because a 60-year-old and an 85-year-old may not be able to do the same kind of exercises. So we have to cater it based on the person's physical abilities as well. And exercise is the important thing actually with strengthening muscles and preventing weakness.
I understand. Yeah. So in other words, from what I heard from Dr. Jolene, is that it's not necessary, if the outcome, the result is bad, it's not necessary to go to see a geriatrician right away. Or a specialist right away. It really depends on the condition, and then we have kind of a customized package or customized advice, recommendation to help them to strengthen that muscle. And another thing also, I think which is some of our audience that ask about the mental health and cognitive screening. So will that cause, what is the possible outcome? I think the worst might be dementia.
So from this health screening, in terms of the memory screening alone, it's a few basic questions because it's a screening.
Right.
So what we're trying to do is to piece out whether you are at risk of a memory issue or not. So definitely if you have a loved one or if you yourself have forgetfulness, and you do worry that you have memory issues, then I think that would warrant seeing a geriatrician from the onset, because then you probably need a bit more thorough evaluation. You need a brain scan, you need some specific blood tests to check and screen for dementia. But the screening test that we're mentioning here, it's more for people who maybe you're just a little bit forgetful. Sometimes you go to the fridge and you cannot remember what you wanted to take, which that happens to some of us from time to time. But if you're just concerned whether or not there is some of these memory issues, then you can do the whole screening, and then from there we can piece out whether there is a need to then go on to do a bit more thorough evaluation, and that will involve seeing the geriatrician.
I see. Can you explain a little bit more about what is the further evaluation or further assessment if indeed this patient has poor memory and that could possibly lead to dementia?
Okay, so basically in the geriatric clinic, we'll do the history, take a very thorough history, asking what things happen, what are the specific issues that patients, sometimes it's not involved only memory, it's the orientation, they get lost in their familiar environment, they lost their debit card, they lost their ATM card, or they forget the PIN of the ATM, that they cannot manage their finance. Or is it like something about language, they want to say something but they cannot able to say out or say out a different words than what they meant. So there are different parts of it that we'll do a memory testing at the geriatric clinic. Then we will assess is there any underlying medical condition, and come up with recommend any investigation like blood test or brain scan, and then further evaluate from there. So just now I think audience asked about mild cognitive impairment. What is it? Is it a normal aging? And then the mild cognitive impairment, usually they have some memory problem but hasn't affected the activities of daily living, but their memory is slightly worse than the normal aging. But obviously the worst is dementia. The mild cognitive impairment, some people may say like that, some people may improve, and some people may worsen and it becomes dementia. So you need regular monitoring and then see if there's any progression.
So actually, that is something, there's a word from Dr. Chen catching my attention. It's possible to be improved. It's possible to
That might, some people might, but sometimes it's just stay the same.
Right. I've always thought that the best, is to stay the same. If I could stay the same, it's the best solution I would ever get. But if can improve even better, so it's possible to get improved.
Yeah. So that's why we need to make sure keep our body healthy, keep the mind healthy, physical healthy, have a good sleep, have a good diet, and then also get socialized as well. It's multiple things that work together that help you healthy and optimize your care.
I understand. Right, there's a few questions from the audience about the screening, which is good. I think everybody is really take good care of themselves. They really care about their health. This question from Maureen is what blood test will be done in the screening?
Oh, okay. So, as part of the package in the blood test, the blood test for the geriatric screening, of course, on top of all the other regular blood tests, we will normally check, the full blood count, the kidney function, the liver function, definitely screen for cholesterol, because this is something that is treatable and preventable. High cholesterol that is untreated can actually lead to a lot of complications, such as heart issues, heart disease, and stroke. So we definitely screen for the cholesterol. We also screen for the sugar to make sure there's no history of diabetes, because that is again another treatable condition. And of course, specific to the geriatric side of things, we also screen for vitamin B12. Because B12 is associated with brain health and the nervous system. So we want to make sure that the B12 is adequate. And similarly, we check for the folic acid levels as well. And aside from that, we also check vitamin D. Vitamin D is something that is also very important for bone health. Yeah, because a lot of times people focus a lot on calcium. You take calcium, but actually, if you take calcium but you don't have adequate vitamin D, then actually, yes, because the calcium doesn't get absorbed into the bone. So actually, you do need the D. So the D must be adequate. They're equally important, basically.
And the most common source of the D is from the
sunlight.
From
the sun, yes.
Right.
And a lot of times our older persons like to stay at home and they don't go out.
To get full. That's another thing. Yes. And another thing, because my mom's skin is very thin, it's very easy to get burned. There's another concern that I have why I do not bring her out as regularly as I could. But nevertheless, let's continue our question. And the next question actually quite similar. I will ask them together. Patrick said, do we need to do this elderly screening, which is a geriatric screening, annually? Another audience is BB said, ask, is this geriatric screening done regularly or in standard sessions? I'm not sure what about standard sessions.
Okay, so the recommendation is do it annually. I think as in all health screenings, you should do it once a year because you want to keep your cholesterol, all the chronic illnesses in check.
Right.
But of course, within that 1 year, if your health condition changes, if there are new symptoms or signs that you develop, of course, seek health care attention earlier. But the screening, the recommendation is to be done once a year.
I understand, once a year. All right. Another question is that this is a good question. What are the common misconceptions regarding geriatric screening? Misconception. Why people thought it's not needed, for example. Why is this another health screening? What do I need? Specialize myself in a geriatric screening. So what is the most misconception about geriatric screening?
I think a lot of times with health screening, some misconceptions is that you don't want to check because you don't want to know. I think that's what a lot of people...
you don't know, that means that there's not any shit.
Yeah, so you feel well, don't need to get checked, might as well not know. Better not to know than to know. I think that's what some people feel.
True. That applicable to the normal health screening as well.
Yes, right. Absolutely. Yeah, but I think with the aging population, as we've mentioned earlier on, I think it's important to look after our health now as an earlier stage. At 50, at 55, you look after yourself so that you prepare yourself for when you are 65, 70, 75. Because as we age, as I've mentioned earlier on, there are inevitable physical changes and body changes that will happen, and that's part of aging that we cannot avoid and prevent. But if we take charge of our health earlier, we do a health screening, then at least we can identify any issues earlier and then try and prevent complications from happening, try and make some lifestyle changes early so that you don't run the risk of complications in our later life.
True. Yeah. That is very important that we need to adjust our lifestyle, because what I always try to tell my parents, right? Sometimes we have to run loud. Right? For example, today I'm wearing glasses because we are Hua. So you have to admit that. So once you admit that, you will start to do all the geriatric screening and all that, because you know that your body function, everybody will get old. It's inevitable. So the next question is from Edwin. While there are consultant specialists managing most disciplines, what are the key circumstances that geriatrician usually takes up as primary inpatient management? Oh, okay. You can answer the question.
Yes. Right. Yeah. So primary, usually we say patients are coming with falls, coming with acute confusion. So usually these are the two primary that we can do. We can screen, and then after that we find out what's the underlying cause. Then we usually work with a multidisciplinary team, which means we work with the nurses, some allied health professional like physiotherapists, occupational therapists, dietitian, and so on, speech and language therapists. If you need, because for example, as a patient coming with a fall, sometimes they're scared of fall. So we need to get the patient be able to walk again. So I need the help and work together with the physiotherapist to work with the patient to gain back their mobility. If they have a memory issues, they become confused when they're in hospital, I need the occupational therapist help to do some cognitive stimulation, help them to know how to do the activities of daily living, also educate the carers how to make sure, teach the patient to walk, have a look at the environment, whether it's anything that we can do. If the swallow is not good, then we'll involve a speech and language therapist to see what kind of food that's suitable for patient and what kind of diet, and involving the dietitian that suits the patient. So it really depends on what the patient needs. Then we'll come up with an individualized care plan that suits the needs of the patient, and then we have a care plan goals and see what kind of goals that we want to achieve. Because different people is different, like 70-year-old coming with a fall, depending on what their baseline walking is, and if an 80-year-old come in, their baseline walking, let's say it's a bed bound, then their goals of treatment will be very different.
True. It's really very customized for each individual patient based on their condition. Yeah. And then I would like to ask, right, at what age usually they should visit a geriatrician?
Usually I would recommend 65 years
old and above. I understand. So what kind of symptom they should come? Of course, I would encourage them to do the geriatric screening, but if it so happened they have some symptoms now, what kind of symptom is really put up a red flag they should see a geriatrician?
So let's say they have tripping. You don't think it's a fall, you just trip but never injured yourself. Start to have a few tripping, but actually they are falling but they haven't had any injury, should start. Or you notice that there's some memory problems. You notice that they start getting slow, muscle getting weak. Then it's also a sign of they have incontinence as well. These are the things that quite common happen in elderly people that can start looking for geriatrician. Or if you do not know, the patient presents with multiple things that you do not know who to see. If you are aged 65 years and above, you can also visit a geriatrician. Then the geriatrician can recommend who do you see next. Or you're on multiple medication, you're not sure whether you want to continue those medication or not, you want to review, then you can also see a geriatrician. Then we can have a thorough review of your medication as well.
I understand. And then one thing to add, if they want to improve their lifestyle, the quality of life, they should come and see a geriatrician as well. So what kind of recommendation you would do, or what kind of assessment you do in terms of their lifestyle?
So usually we'll assess their lifestyle and see how much exercise that they do, what's their diet is like, how's their sleep, how's their mood, because a lot of people suffer from depression that do not know because of loneliness. Children all go out and work, nobody at home, nobody to speak to, and older friends started to go away already. So we have to recommend it and then have some social, go for a socialization, go out with friends, play things, and have a good diet, how to have a good sleep hygiene to try and maintain their healthy lifestyle and keep their independence as long as possible.
I understand. So I know we almost, there's a lot of questions here, however, we couldn't answer all the questions. If you all need to visit a geriatrician, please visit our website, make an appointment with Dr. Chen by visiting our website, or call our hotline, which is 037-491-9191. And of course, if you would like to sign up for the geriatric screening package, tell you what, currently we're running a promotion. If you are Sherry's member, you can get 30% off. If you are Sherry's member, you can get a 30% off. And then this is the what is shown on the screen is a QR code for you to do the geriatric screening. Again, remember, if you are Sherry's member, you can get a 30% off. How to get, if you're not a Sherry's member, don't worry, it's very easy. It's lifetime membership. As long as you are a Malaysian, you are a PR, and you are 60 years old and above, you can get a cherished membership. My mom is a cherished membership, by the way. So because I've been visited here many times, unfortunately, not that I would love to bring her here, but it just so happened because she's really 86 years old. So again, I think now it's really the questions, the quiz section segment. So I'm sure you all have been waiting for this as well. Besides all the fantastic sharing by our doctors, I'm sure you want to know what are the questions I'm going to ask. So this is how it works, right? I will ask the question on the show, and then if you know the answer, it's a multiple choice question, you just type A or B, all right? And after that, I will randomly scroll the answer, and I'm going to scroll the screen and point at the answer. If the answer is correct, then congratulations, you will take away a portable electric juicer. Okay, let's see. What is the first question? Alright, geriatrics refers to A. Medical care for older adults, B. Scientific study of the earth. It's quite obvious, right? I just want to give away the prize. Okay, let's see. Alright, wait, because there's a delay, because it's a live stream, there's a delay from the live to the Facebook, so I'll give a few more minutes for you to type the answer. So geriatrics refer to medical care for older adults, or B. Scientific study of the earth. Okay, let's see. Alright, I give some time for you to... Okay, here are the answers. Alright, here are this person. Nikoru-san. Is that Japanese? Nikoru-san, congratulations. Yes, the answer is A, so you will get the portable electric juice. Okay, second question. A geriatrician is... we have two geriatricians here. A geriatrician is... Beautiful lady? No. Alright, yeah, they are, but it's just like the question. The answer A is a person who studies geography. Be a doctor who specializes in the care of older adults. It's so obvious already this question come out from me because I thought geriatrician is a geography. It's just something about geography. So again, a geriatrician is A, a person who studies geography. B, a doctor who specializes in the care of older adults. Okay, give a few moments for you to type the answer, Okay, again, guys, please make sure you do this screening. If you are a charity member, you get 30% off. And then if you are 55 years old or above, definitely is advisable to do this screening. And if you are 65 years old and above, you can straight away to visit a geriatrician, and then you can make an appointment through our website. Okay, let's see. All right, a geriatrician is. All right. Okay. This person. Oh, okay. Bisan Lee. Question number 2 is B. Yes, a geriatrician is a doctor who specializes in the care of older adults. Congratulations. Okay, next question. At what age? Yeah, I intentionally told the answer just now. At what age should an elderly person visit a geriatrician? At what age should an elderly person visit a geriatrician? A, 65 years old or above. B, 55 years old or above. It's a bit tricky, but I already mentioned it just right before the question was asked. So, all right. Let's see, question number 3. Okay, let's give a few moments. And okay, guys, and again, guys, we have by the way, we will upload this is Facebook Live. If you would like to play back the whole live streaming, please feel free. Please make sure you visit our Facebook, our Sunway Medical Centre, Sunway City Facebook to watch the playback. And of course, feel free to share this Facebook Live to your friends, especially those who are 55 years old or 65 years old and above. Okay, question number 3. All right. All right. Cha Hun. The answer is A. Yes, correct. You are advised to visit a geriatrician when you are 65 years old or above. So that is the right answer is A. Cha Hun. Congratulations. Okay, question number 4. At what age you are encouraged to do the geriatric screening? At what age you are encouraged to do the geriatric screening? So for this question, I would like Dr. Jolene to pick the winner, okay? And then while waiting for the audience to reply with the answer, can I have the QR code as well for the screening? Yes. So if you are interested to sign up for this geriatric screening, you can scan this QR code, or of course you can visit our website anytime. And also if you are a charity member, you will get 30% off. And if you do not have the charity membership, it's very easy. As long as you are a PR, you're Malaysian, if you are 60 years and above, you will be able to apply for this lifetime membership to be a charity member. Okay, let's see. All right. Okay. Yes, just pick one. Okay, let's see. Oh, don't do it again. You don't remove your finger. Oh. All right, so I can see it. Okay, Lin Xiu Chan. Lin Xiu Chan. The answer is A. Sorry, so it's not correct. So quickly, the next person should please get it right, huh? Okay, let's. Let's do it again. Wait. Okay. All right. You just swipe. Okay. Okay, here. Yok Yi Tae. The answer is B. Correct. 55 years old or above. You are advised. You are encouraged to do this geriatric screening. Okay, last question. And also, by the way, please, our admin will contact you after the show, so to get your personal details, your contact number, and also the shipping address, so we can ship the electric portable juicer to you at your doorstep. Okay, question number 5. For our geriatric screening package, if you are a Cheryl's Card member, you will be entitled to A, 20% off, B, 30% off. Yeah, it's very easy. So, once again, if you are a Cheryl's member, how much discount you get? And if you are not a Cheryl's member, very easy. Just make sure you apply for one, and as long as you are Malaysian, you are a PR, if you are 60 years old or above, you are eligible for it. So please make sure you apply for it. It's not just for this screening as well. If you, for some reason, unfortunately, you need to admit to the hospital, you will get discount for that as well. All right, I know because my mom did. Okay, so for our geriatric screening package, if you are a Cheryl's Card member, you are entitled to 20% off or 30% off. Let's see. All right. Okay. So this one I will let Dr. Chen to pick. Okay. Don't let go your finger. Okay, and done. B. Correct. 30% discount. Correct. Congratulations and done. Okay, congratulations to all the winners. And again, our admin will PM you for the contact number, the shipping address. So we will send you the portable electric juicer. All right. It's almost, I think it's already 12. So unfortunately, this show is only for 1 hour. And again, if you have any question, please make sure you can visit our website. To ask along the question. And also, if you want to watch the playback, please do to visit our website or our Facebook. And last question for both doctors: what is your advice for all the age adult or older adults?
Okay, maybe I'll start first. I think the important thing is we all want to age well. We all want to age gracefully.
Right.
We want to live independently as much as we can when we're older.
Right.
So I think the take-home message is look after your health from an early age. Get yourself screened, and then eat well, eat healthily, eat a balanced diet, keep yourself physically active, because these are all important things to take charge of and look after yourself now in order to be able to live a healthy older age.
But however, I would like to add on is that, right, if you need help, there are more people willing to help more than you thought. So don't hesitate to ask for help, to ask for any assistance. Right, Dr. Chen?
I would say keep active as long as you tolerate, because I always like to say if you don't use it, you will lose it. No matter for the brain, for the bones, for the whatever the body physically and mentally and socially as well. So everything together. So keep going as long as you can, but be careful at the same time.
Yes, that's the key word. Be careful at the same time. Don't force yourself, must admit, run loud. But at the same time, you must keep yourself, even though, I'm old, yeah, I'm 47. I never hide my age, but you need to keep yourself active, but to be safe at the same time. All right, once again, thank you so much, Dr. Jolene, Dr. Chen, to be on our show today. And thank you so much for all your supports, guys, and really appreciate for those who have shared our live streaming, and for those who have been actively comment and actively giving love, some flowers to our doctors. So till we meet next time, you all have a great Sunday and take care.